Hey everyone, good afternoon. This is Dr. Sullivan with you. I am a little bit early tonight. We usually do this at 6, but I have a few reasons that I have to get this done a little bit earlier. So I hope plenty of you will watch it on the rebroadcast. I am Dr. Karen Sullivan. I am very proud to be a board certified neuropsychologist. I practice in North Carolina, but I am connected with so many of you throughout the United States and the world really through this Facebook lecture series, and that thrills me to no end because I know that information and education has the power to really strengthen people in their recovery and to help them become the very best advocates that they can for themselves. So what I've done in the last 2 weeks is we've talked about the 10 rules of rehab as it relates to stroke recovery. And if you remember, lucky number 10, the final one, was the transformational power of acceptance. And so tonight what I'm going to do is put on more of my psychologist hat instead of my neuro hat, and we're going to talk about this very important aspect of recovery. And the truth is, it really does not get enough attention. We can focus so much when we think about neuroplasticity with the first two and not incorporate this final third one. So the first two is regrowth at the biological level, neurons actually regrowing, resprouting dendrites. We can also talk about regrowth in terms of compensation. What are workarounds? What are some ways that maybe you can't quite do something the way you did before, but you can actually find a way to go around it and do it different? But there is also psychological regrowth that has to happen. And when I tune in to a lot of the Facebook stroke groups, there's so much suffering that I see is going on because people can set up unrealistic expectations about recovery that it's either an all or a nothing kind of a thing. I either have to get complete recovery of my affected side back or my vision back, or else I will not have been a success in my recovery. And I really want you to start to think about it a little bit different. So this topic tonight really reinforces to me what I love about being a neuropsychologist and why I always encourage you all to learn more about what we do as a professional subspecialty in the brain, but also seek out your own neuropsychologist. I really think that we are the professionals that you've been wanting and that you've been needing in your care, because instead of just coming at your brain issue from a medical point of view, we can do that and we can help you with understanding what structural changes have happened and what cognitive changes have happened, but we also really care about it through the lens of the self. And it's not just a brain problem, it's a self issue. It is a psychology issue. It's an adjustment issue. It's a family issue. It's so much more than just how you walk or how you think. So really this talk applies to all of us because to live is to experience trauma, unfortunately, for many of us. And this talk really applies to people who have had loss and unexpected things happen to them that have caused them to suffer. But of course, the severity of all of our pain and trauma is different, how much of it we've had, and of course, the interpretation that we give it in our own minds. And that's very key. But trauma, unfortunately, is almost universal. So really, I hope that this talk tonight applies to so many of you. But really, my invitation is, of course, to my people out there who have experienced a brain health challenge, something like a stroke or a diagnosis like Parkinson's disease, essential tremor, dementia. And really what I'm hoping is, as a result of tonight's lecture, that you will grow to think about acceptance in a little bit more of a progressive way, a little bit more of a loving way, because the truth is we often mislabel acceptance as giving up, and that's not at all what I want you to do. I want you to be giving your recovery your very all of your mental effort, all of your physical strength. But the truth is, if we resist what has changed, that is a form of bondage. And I want you to have a more flexible, non-judgmental view of what is happening in the here and now, because I really believe that it can improve your quality of life and your relationships with other people, but maybe most importantly, your relationship with yourself. The thing about acceptance is it is a dynamic process. It would be a delusion to think that you are going to one day become amazingly accepting of these things that have happened to you. No way. It is a feeling that comes and goes. It's a feeling that starts off, I think of it like a bricklayer. You put down one layer one day, the next day you might get a little bit further. But the truth is it ebbs and it flows. So don't have unrealistic expectations that, this is yet another thing you're failing at, right? I'm not accepting. Just try. Try and learn and think about doing it a little bit different. So after we experience a trauma or a loss, almost universally, we experience the phase of shock, kind of disbelief, almost like a little bit of dissociating from reality. Did this thing really even happen? Because a part of trauma is the suddenness and the extremeness, that it was life-threatening or something that was really kind of harrowing happened to us. But after that phase, most people get into fight or flight. This is a very natural biological reaction. And so the fight is the strength, the willpower that I'm going to get this. The flight, oftentimes we can't do because maybe we have physical symptoms, we have paralysis, we have weakness, maybe we're in the hospital, maybe now we can't work. And so we ain't going nowhere. Here we are in our lives. And I really believe that fighting has its place in stroke recovery, but the tough determination that you use to push through an intense physical therapy session can really also be harnessed to be used in your fight with acceptance. So I really want you to consider approaching acceptance with the same tenacity that you have been approaching other aspects of your recovery. So what does acceptance feel like? Okay. It's a light feeling. It is a feeling of peace and comfort, which is in contrast to the feeling of resisting, which happens if you insist on being transformed back to the exact way that you were before your stroke. If that is the only way you will consider yourself to be whole or healed or recovered, then I'm afraid that you're setting yourself up for an inevitable fall and depression, because unfortunately that is not very realistic for most people after a significant stroke. And really, what would we all choose? Do we want to feel tight and resistant and hesitant, or do we want to feel that wonderful feeling of peace and acceptance? And remember, it's not an everyday feeling. What I'm saying is if you can just inch yourself closer to more of that calm, comforting feeling, then that's better than us not talking about these things and feeling like unless you give it your all 24 hours a day, you're not being successful. So, what I try to do is take wisdom from all sorts of resources. You guys know I'm very research-based, very science-based. That is a big part of being trained in the American scientist practitioner model, is that you need evidence to come to conclusions. And we also know, though, that there are some other traditions that have a lot of wisdom. So one of the things that Buddhism has really taught us is that one of the reasons why we suffer is because of our attachment to what was, our attachment to fear of what might be. So one of the things we often do in Western culture is we get very attached to our professions representing ourselves, to the fact of what we do means who we are. So one of the biggest blows after a stroke is maybe not being able to do the same thing that you used to be able to do before. And of course, this then messes with our sense of identity. So the fact that our abilities change after a stroke can very often change our ideas of who we are. If we don't accept what has happened and try to reduce that attachment to the concept of who we were, this can create so much constriction on who we are now that we can't regrow and sprout new self cells, right? We are always talking about brain cells, but what about new parts of ourself that need to grow? If you have a beautiful plant and the pot is too small, it can never grow new roots, right? You're never going to see that new growth. So like I said before, for the vast majority of you who've had a stroke, the truth is recovery is never ending. You will always find little ways to improve and compensate. but you're also not going to return to a carbon copy like you were before. This experience of having a stroke, I believe, changes most people's sense of self and your worldview, the way you think about things like health and your stability and your sense of safety in the world. Acknowledging these changes and really allowing yourself to accept what is now, to me, is a huge understated aspect of recovery. So there are people that study something called post-traumatic growth after a trauma, and they tell us that there are typically 4 stages to adjustment. The first one is shock, like I said before, and I wonder if all of you can remember those early days, those early hours after you had your stroke, kind of like hard to wrap your head around what's happened. The next one that we know is completely normal is something called retreat, that we kind of, go into ourselves a little bit, and, a very tender time, a very sensitive time of trying to make sense of what has happened. The third stage is acknowledgement, and this is one of the things I want to talk to you about tonight, is until we acknowledge what has changed, and in some cases what we have lost, we cannot move on to adaptation. So this is why I feel so strongly that psychology, mental health, has to be a part of the recovery conversation, because if we don't have times of reflection, we don't get validated for what has changed in our mood, in our behavior, in our relationships, in our lives, we can never acknowledge it, because part of human nature is to avoid unpleasant feelings and things. And we've talked about that before, but avoidance really digs you deeper into a dark hole. It's really one of the worst things that we do psychologically, but we've got these coping skills in our brain that tell us, go towards the positive, go towards the sweet, don't go back towards the thing that causes you pain. But sometimes psychologically we have to turn that around. One of the things that gets in the way, like I said before, is that people feel like acceptance means giving up. So what if we just change the word a little bit? Maybe instead of acceptance, we can talk more about adaptation. I personally think that that sounds a little bit more like something I would want to do. So whatever you want to call it, I don't care. But I do want you to carve out a little space in your thinking for this topic tonight. So I always like to give you guys action steps. To me, the way this works best is if I give you some really good food for thought, some good education, but then I tell you what to do with it, right? Okay, so I'm inspired, I'm interested, I realize I'm paying a price for not working on adaptation or acceptance. Okay, you got me, but where do I go from here? So I always like to think about helping people develop a map, okay? The first thing in acceptance is that you just have to know it is simply going to take time in order for you to comprehend what has happened to you. There's no way acceptance can come in the first week after a stroke, really even the first couple of months. And people that claim to jump right into acceptance, I would argue as a psychologist that maybe there's some defensiveness going on, some denial. So the first thing is, it takes time. And to me, when people say be patient, it takes time, I find that to be one of the hardest pieces of advice, because man, if I'm anxious, if I'm upset, I want to go into problem solving mode and to get things settled and figure things out, and that's just not the way it works all the time. Number 2 is that we have to acknowledge what has changed and what we have lost, and this is where self-expression comes in. So this can either be journaling, this can be therapy. If you don't do it consciously, guess what your spirit does? It dreams it, okay? This shows you that there is such a profound human need to process trauma. Your brain will find a way to do it no matter what. A third part is we have to give ourselves permission to grieve, and you have to give people you love permission to grieve. Many of us are not brought up in families where it is comfortable showing a lot of emotions. And I've even been in acute recovery rooms with people who've had stroke, and the person will start to cry, and someone in their family will come over, completely well-intentioned, but come over and dab the tears and say, don't cry, please, oh no, I don't want to, like, the truth is it's making them feel uncomfortable. And I think, we always want to take away the pain of people that we love. And I understand it, but the truth is, let those tears flow. First of all, you're getting rid of stress hormones, which is fantastic. But also that is part of the grieving process. The truth is, people do lose things when they have brain health challenges. There is loss, but it doesn't all have to be loss. It doesn't all have to be negative. So those are very, very important steps, and those 3 steps could take you a while. Once you work through those, the 4th one is focusing on what you can still do well, okay? And finding ways to do the things that are hard through creativity, determination, and support from others. This is all the workarounds. How do I get to the same endpoint, but maybe having to go a different route? Sometimes you don't have a lot of control over this. Maybe you don't have supportive people around you. Maybe you don't have insurance and you can't keep going on with rehab. That's why I always use the word creativity, and it's amazing how much effort you may need to put into this, but the truth is that there is typically other ways of doing something. We just haven't thought about it yet. The 5th one is surrounding yourself by people who are validating and have thrived in the face of adversity. So I have seen people who have lost one arm meet up with someone maybe through a support group or a hospital, someone who has actually lost both arms. So I'm thinking now of veterans returning back from Iraq and Afghanistan. And that, as hard and as unpleasant in some ways as that sounds, that could really be inspiring to think, God, here I am thinking I have it the worst. But you know what? This guy doesn't have a right arm. At least I have this one arm. And it's not about one-upping anyone's pain or finding any kind of pleasure in anyone else's pain. Of course not. It's truly inspirational to see what people can recover from and see how low people could have been at one point, but how they pick themselves back up. So being inspired by the adversity of other people is very important. Number 6 is finding an activity, a mental interest that makes you feel strong and powerful and competent. One of the things I often say is that a stroke happened to the brain, not necessarily the mind or the spirit. Now, of course, depending on the severity of the stroke, that may not be realistic. But for many people, they can still do a lot of things with themselves, spiritually, mentally, and socially. So finding something that you can do that gives you those psychological feelings of being empowered, feeling strong, feeling like yourself are very important, so you don't get so far away from positive emotions that you get so out of practice you don't even know what it feels like anymore to be competent. Okay? And the final one is to find a way to give back, lessen the pain of someone else based on what you have lived through. This is the full cycle of trauma. And I know I'm going through these like lickety split, but the truth is they take a long time. But if you at least have the map, right, you can listen to me and figure out where is it that you've been and think about maybe next steps. Now, I did want to tell you guys about a type of therapy that really focuses on acceptance, because maybe this sounds really good. You've really needed to think about this. You know in your heart somewhere that you are resisting and you need to accept. There is a type of therapy called acceptance and commitment therapy, and we call it ACT, A-C-T. It is a type of counseling with an evidence base that uses acceptance and mindfulness strategies in different ways to help you change your behavior, which then changes the way you think and feel. The idea is to help you think about things differently and in a more flexible way to stop some of that resistance. So the idea of a lot of these therapies, including ACT, is not that you get rid of negativity in your mind and in your thoughts and in your feelings. It's that you don't identify with them, that you don't fuse with them, that you don't believe they're dirty tricks. Because the truth is, we interpret reality according to our mood. And if you are struggling, a lot of times you're not going to have a great mood. And that's kind of like your lens that you interpret reality through. So what we try to do in ACT is to have people not necessarily believe their thoughts or their feelings and not get attached to them. So to be able to be a little bit detached from their thoughts. So for example, having a negative thought about something you can't do now that you've had a stroke, instead of believing that you really can't do it, you can actually get a little bit of distance from it, and people talk about it floating by. You know, I had the thought, I don't necessarily believe it, and I can see that it's just moving by. I don't identify my own personal self with those negative thoughts. It's really interesting. So they teach us about things like cognitive distortions and how we think we can predict the future and how we all give into all or nothing thinking. And there's all sorts of ways that we take reality and basically distort it. So one of the techniques that they use is trying to make sure that the behaviors that you do are in line with your true values. So this is really the key to ACT. So the first step is, of course, defining what are your values. So the idea is that values inspire the activities that give our lives meaning, right? It's kind of the wind beneath our wings, the wind in our sails. We use our values to make the choices that are meaningful to us about who we want to be, the kind of things that we want to represent in the world, what we really want our lives to be about, right? When we do things that are in line with our values, this is where we find meaning and therefore happiness. So even in the face of the most painful, difficult things, ACT would tell us if you are acting in accordance with your values, you will be happy. Okay, this doesn't mean you're going to be ecstatic and not have any struggles, but essentially you will find meaning in your everyday life because you are living your values. So this is not based on what I think your values should be, what your friends think they should be. It's very important that you get clear on your own about what your values are. And we're going to talk about these in a minute. So what ACT teaches us is that when we don't act in accordance to our values, that we are basically fundamentally unhappy and anxious and depressed. And that what happens is we then start to avoid things in our life because we always try to get away from the negative and go towards the pleasant and the easy, right? But ACT tells us the things that are difficult actually wind up bringing us some psychological satisfaction. So maybe you have been resisting grieving, but ACT would say that's the very thing that you need to do, because if you value living a life where you are present, where you care about yourself and other people, the only way that you can really fulfill that value is to be able to move on and to accept what has happened. Now, I know it sounds easier than it is, but I think that it's important. So one of the things that ACT talks to us about, getting back to the A, C, and the T, the A is to accept our reactions and simply be here now, not holding on to the past, not bracing ourselves for what might happen in the future, but really just to try to be here now. They then encourage us to identify our values and to choose a valued direction. So if you're sitting on the couch and you feel so depressed that it's hard to get up, if you're not thinking in your mind about the reason why you might get up, you might just wind up sitting there all day. But in your mind, if you've identified that one of my personal values is that I am determined, I try and try and try no matter what, believe me, you are going to be much more likely to pop up off that couch than if you don't sit there and think about what's meaningful to you. So I hope that that makes sense. So the A is acceptance, the C is choose a valued direction, and the T is to take action. So how is it that you can identify these values? Well, they talk about having us think about 4 areas of our life. The first one is work and education. So this is things like developing your skills, what are the things in the world that you are most curious about. And one thing I often tell people who are struggling after a stroke is you just got yourself a PhD in stroke, because you are developing expertise from what it is like to live from the inside out with a stroke, and that expertise in the world is valued. I value that. Your good doctor should value that. People who care about you should value that. That is important information because it can alleviate the suffering of someone else who's going to be walking in your same shoes. Think of all the things that you have learned in your stroke journey. This is why I love these Facebook groups for stroke, because people are so supportive, and there's no reason to go through 10 attempts at something when somebody could just come along and say, hey man, I was there 2 years ago and I know exactly what it is that you should do. And remember, that's that final piece of the trauma circle, is that finding a way to alleviate the pain of other people based on what you've been through. The second value area, domain, is relationship. So, who do you really care care about? Who do you want to be connected to? Who are the people that you trust and really love? And making sure that you're making decisions about your daily life and your behavior that are aligned with the commitment that you have to those people. The next one is maybe the funnest one. This is about your personal growth, you know, things like your spirituality, your creativity, your nutrition, your appreciation of nature, your relationship to God, your church community. There's so much there that we value that it's really important to just get super clear on what means the most to you and how can you live a life that is in service to those things. And the final one is our leisure life. How do we relax? How do we stimulate ourselves, excite ourselves? What are the things we like to do for fun, for recreation? So those are the 4 things to focus on to say, you know what, these are the things that really matter, okay? So ACT also tells us what makes it worse, okay? So there's 4 things that can move you away from acceptance, okay? And remember, all we're trying to do is to move more forward. I think it's unrealistic to say, acceptance is a destination, and if you don't get there, you know, that's just yet another thing that you're not doing well. No way. It's just a flow, a process, something to be mindful of, to create some time to think about instead of just being go, 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 recover, 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 get back to the way I was before, right? So the first one is our entanglement with our thoughts. So what do I mean by this? This is basically the thoughts that you know are negative. They're based in worry, they're based in fear, they're based in self-criticalness. They're not helpful, they're not your friends, they are not true. You have to be able to articulate for yourself what are these things and to realize just because I think them doesn't mean they're not true. The next one I love, it's called life-draining actions. Boy, have I done this at times. So these are the things you're currently doing that are actually making your life worse. These are behaviors that are making you stuck. They drain your energy. They restrict your daily life. They hurt your relationships. They hurt your health, right? These are things like staying inside all day because in a way it's kind of easier. But the truth is you feel like crap after you spend the day inside. And really, you would have really helped yourself if you would have even gone out on the porch, okay? So you have to recognize when you're doing something in which you're acting like an enemy to yourself and not your friend. The next one is struggling with feelings. So these are the emotions, the feelings, the impulses that you avoid. Remember, one of the forms of suffering is being so attached to our emotions, right? Many times me and other psychologists in the area, we get together and if we share a patient, we try to talk about how can we help that person. Sometimes, I'm going to tell you the truth, one of our struggles is we wonder, does the person really want to be helped? Do they want to detach from their pain? And it's a hard question to ask yourself, but have you become so comfortable with feeling like shit that you don't really know how to act another way? Are you afraid that if you believe in something good or positive, it's just going to be taken away from you anyway? So why even get excited about something? I hear that all the time, and that is so, so, so sad. But that's what trauma does to us, because once that safety illusion bubble has been popped, we look for trauma and loss everywhere. But the truth is that that is a distortion. The only thing that makes trauma happen in the vast majority of cases is bad luck, right? We're so ready to take too much responsibility. Now, there is a time and a place for responsibility. If you did something irresponsible and that led to your problem, you might have to do some, take responsibility. But for most of us, it really was something that was random. And for whatever reason, psychologically, that makes us feel even more anxious. So we find a way to lie and distort reality to make it somehow we could have done something differently. And the final one is avoiding challenging situations. The more you avoid, the more you are going to stay stuck. So it's very important to actually stop putting things off, to actually just do it. You just have to get out there and get some things done. Certain things, if you've been avoiding them, if you've been avoiding crying, if you've been avoiding telling somebody something important, it's just really important to help you move on, to move some of those barriers out of the way. I really hope that this was helpful to you all in some ways. I am working very much every day on the stroke guide, trying so hard to have it just be as comprehensive as possible, and I will certainly let you know as we get closer and closer to finishing that. If you would like to share this with other folks in your Facebook world, I would really appreciate it. It means so much to me that people have access to information. There are plenty of things in life that we can't do to help people in pain, but I think there's no reason that people shouldn't have information readily available to them and delivered in a way that is supportive and kind. So thank you guys so much. I love being with you here every week, and I will be back next Wednesday. Have a good night, you guys. Bye-bye.